Ramon, we're good? I can't even see him. All right. Good evening. We're going to go ahead and get started because I know we told you guys 6 o'clock, 6:30, I'm sorry. And I see where everybody sits at church. So thanks, thanks for the brave ones who up front. But Dr. Mara, you're here because Cherokee County School District has adopted a program called Game Changer. This program is to help student athletes with mental health issues. And trust me, there are scenarios, situations that you absolutely probably don't know about, but we have some issues with sometimes our student athletes, and this program will help us. And we're glad to have all the parents and student athletes that sacrifice their time right after practice. I know this is an awkward time. You're in your season, but this was the time we could get it in. And I truly appreciate each and every one of you coming out here. Before we get started, I'd like to introduce Dr. Mara. He's to my right here. He's been coming back and forth. He was met with your coaches, your head coaches this morning, some of your assistants and your head coaches this morning. He met with them. He's already met with the winter sport coaches and their parents. And so it was your turn. We also have to meet with the fall coaches as well, but we're just excited about this program. We know if it's used correctly, it will save a life. It could save a life one day, or it could just save any type of situation. So we just appreciate, once again, you guys sacrificing coming out here. I'm going to talk a little bit about Dr. Mara before he starts. Rahul Mehra, he's the CEO and Chief Physician Executive of the National Center for Performance Health. Dr. Mehra is board certified by the American Board of Psychiatry and Neurology in Child, Adolescents, and Adult Psychiatry. He has been in active clinical practice for over 30 years. Dr. Mehra currently is a consultant for Major League Baseball and graciously and previously has consulted with the NFL, NFL Players Association, XFL, United Soccer League, and the NCAA. He and NCPH have developed innovative preventive models such as emotional vaccines to optimize human performance. NCPH's clients also include first responders, K-12 schools, colleges, and universities, and nonprofit organizations. NCPH created the Game Changer model that has been used at Limestone University for the last 4 years. This resource has received national recognition from entities like the NCAA. Dr. Mehra is also on the voluntary faculty at the University of South Florida, Mersana College of Medicine in Tampa, Florida. Born in India and raised in Gaffney, South Carolina, Dr. Mehra enjoys passionately searching for hole-in-the-wall dining establishments worldwide. He is joyfully married to his wife, Kathy. You want to raise your hand? And they have 2 amazing grandchildren. So if you'll give your attention to Dr. Mehra, thank you.
Welcome. A lot of open seats up front. Welcome. Great to have you all here. Well, good evening, everyone. Let me begin by thanking you for making the time to being here this evening. And I promise my thoughts will be short, sweet, and to the point. The first thing we're going to do is show a brief video to you that describes the Game Changer program. After that, I'm going to share some more thoughts. And then the third part is I am the most critical part. I'm interested in hearing from you all, wanting your opinions, wanting your thoughts about generally the topic, as well as the program that you hear about in case you have some questions. And so with that stated, let's go ahead and show you the video. And it's only about two minutes long. Game Changer. Hi, Dr. Merrill with you. Prior to the pandemic, the National Alliance on Mental Illness reported that 1 out of 5 adolescents between the ages of 13 and 18 suffered from a serious psychiatric condition. Yet only 20% of these adolescents got any form of professional help. The reason for such a low number seeking help is because of stigma, lack of awareness, and because of limited access to qualified treatment. As a direct result of the pandemic, these numbers are unfortunately worsening. For example, in June 2021, the North Carolina Healthcare declared their own state of emergency in behavioral health. As of December 2020, 40% of all emergency department discharges in the state for children were for behavioral health concerns. That is the bad news. The good news is that as a class of 1979 graduate of Gaffney High School, I am proud to announce a new partnership that my organization, the National Center for Performance Health, has developed with the Cherokee County School District as of November 1, 2021. This partnership is called Game Changer. Game Changer is a confidential resource designed for parents and legal guardians to be able to phone in 24/7, 365 if they are having concerns about the behavior of their son or daughter. Their son or daughter must be a student athlete in a public Cherokee County school. At the time of the initial parent call, a licensed counselor will triage the nature of the concern by asking a few basic questions. Then, together with the parent or guardian, an action plan will be developed. One of the recommendations from Game Changer may be a referral to a licensed counselor in the community. Participation in Game Changer is voluntary. These referrals to a counselor may be for individual sessions for the student, but will always include parent participation and consent. A family unit will be entitled up to 5 sessions of either individual or family sessions in a 12-month period. There will be no cost or co-payment for these sessions. Game Changer will also provide training classes for school administrators, counselors, coaches, trainers, and parents and guardians should they choose to participate. Classes will be offered to student athletes also on topics such as self-care and peer relationships. Participation in these classes will require parent permission. Game Changer is designed not to replace any existing support the district currently has in place or to supersede the involvement of parents, but rather to complement and strengthen these supports for the ultimate health and safety of our children and community. Let me tell you just a little bit more about myself. As the video said, and as Coach Scriven said, I grew up here in Gaffney and graduated high school back in the olden days in 1979. So been out of school for a little bit. Currently, my wife and I, we live in Tampa and we live in Gaffney as well, live out in Grassy Pond. It is something that I cannot emphasize enough to you, that our level of commitment to this community, and that is our priority number one. The other thing that you should know about myself is that in that 30 years of a clinical practice, that most of that direct patient care work has been working with children of different ages in that period of time. Let me talk a minute about some of the points made in the video. The 3 issues that were raised. First, it talked about stigma. Let me ask you all, anyone, any of the student athletes, any parents, what is your opinion about the stigma? Is the concern about mental health and wellness a stigma? Don't be shy. I'm sure there's some people in there who want to say something. And I'm going to come to y'all, by the way. Any thoughts? So further describing stigma, meaning that is it something that's easy to talk about? It is, no? Okay, explain why. You're right. Right, they may judge you, right? And that's a great point. That keeps it keeps adults from seeking out help to help their children. Because number one, they're concerned about the confidentiality part of things. And I can't stress that enough, that if a parent, and it's the parents that have to call in, if parents call in, we don't go and tell Coach Scriven or any principal or anyone else that you all have called in. It is 100% confidential. And that is something that's really the cornerstone of what, counseling services are about, is the confidentiality. The only exception to that is when if a student athlete were either suicidal or voicing a desire to physically harm someone else, then we would need to inform other people. But outside of that, that is not something we discuss with other people. I cannot stress that enough to you. So any other thoughts why there might be a stigma? Because the point made was that people are afraid of being judged. Any other thoughts? Pride? Yeah, they feel like that they might be weak. Is that what you're kind of saying? I don't want to put words into your mouth. Yeah, you're right. So let me ask this, is that if your son or daughter had a injured knee, they hurt their knee, and it's been 2 weeks and the swelling is increasing, not going down, having trouble walking, would you be reluctant in seeking out medical help? No, you wouldn't. Now, the thing to keep in mind, and I'm just raising this for you all to consider, I'm not here to judge anyone, is that if you're noticing over the last 2 weeks that they're isolating in their room, they're not sleeping well, their appetite is poor, they're feeling anxiety, their grades are going down in school, the question then beckons is that might you consider reaching out to someone? Certainly you can reach out to your pastor at church. You can reach out to the counselors at school. This game changer is just one other option for you to have. I would encourage you to at least consider that idea, right? Because the important part about this game changer is this. There is no program like this in the entire country. This is a commitment that Dr. Fall, the superintendent, the school board, Coach Scriven, and Bessie Westmoreland, who's director of student services, this is a commitment they have made to take care of this community. And really at the crux of things, what is most important to really think about, it's not, even though I'm a psychiatrist, it's not my desire where I'm out trying to figure out and trying to diagnose kids with issues. That's not it. What my interest is that ultimately thinking about our young people being success in life and their performance, right? They may or may not go to college. If they do go to college, want them to be successful. If they don't go to college, and let's say they go into plumbing or electricity or whatever it is, that they're happy and that they're successful, that they contribute in their community, right? That they're going to be parents. And because those events that happen in childhood stick with people the rest of their life. And it's better to get these issues and concerns identified immediately rather than having them wait. One of the other points that we talked about stigma is that one of the other points was a lack of awareness and education. What I mean by that is in young adults and somebody in their 20s, let's say, who may be diagnosed with a major depression, an anxiety disorder, or something, a substance abuse, is that in about 40% of the time when those diagnoses happen, symptoms have started presenting themselves by age 14. And by age 24, it's 80% of the time. So let me ask a question. Let's say someone is having some, symptoms of depression. Does anybody have a guess for how long it takes from those symptoms appearing till the time somebody gets some help? The duration of time? 2? 2 years? You were right, 10 years. Man, y'all rock. That's really impressive. So 10 years. So stop and what I want you to think about with that 10 years is this, that imagine a woman has a breast lump, and imagine that they wait 10 years to get that breast lump looked at. What might happen? Yeah, it's not going to be a good outcome. And when it comes to emotional health concerns, when it starts out as even mild things and it's okay to get help early on, is that the longer we wait to get an intervention of 10 years, the more refractory to treatment they become. That's why getting early help is important. Now, let me emphasize, it is not our goal to try to diagnose. That is not the purpose. Because what we further know is that the challenge with stigma is that when there are diagnoses and insurance and there's documentation, sometimes those things stay with people, impact the ability for somebody to pursue military service and other things. So the records that are kept inside us. There's no one else that we share the records with. I can't stress that enough to you. The third point that was made in the video was a lack of access to providers. So I'm a physician, I'm an MD, and really as a child psychiatrist, it's not really about necessarily seeing a child psychiatrist, but that right now in the United States, there's about 5,000 shortage of us. And even when it comes to seeing counselors and licensed therapists, that's very important, whether you use this program or not, but if you do ever seek out help, is that you always want to make sure that the therapist is licensed and they are experienced in working with children and with adolescents, right? So that is the other challenge that we're trying to improve, is improve that access to services. And things. So I can't stress that enough, because by calling into us, we make that seamless for you. What we do, the way it specifically works, is that when you call in, and it could be 10 o'clock in the morning, 5 o'clock in the evening, is that you talk to a licensed therapist. They just ask a few questions about what's going on, what's the nature of stuff, then work with you to help make a decision plan as to what is the best course of action. And then let's say one of those is that we refer you to a therapist. We encourage that. We inform the therapist that you are calling. And again, can't stress it enough, there's no cost for this to you. Now, one of the questions that frequently comes up is you're entitled to 5 sessions. Is let's say someone potentially needs more than 5 sessions. That is something we will work with you or with the family with to ensure that you get the help that you need to get. Because again, that's really about the commitment we have to the student athletes in Cherokee County. So I wanted to make those 3 points. The other thing that if you have not already gotten that you hopefully should be getting soon, the video alluded to it, is emotional vaccines. What emotional vaccines are 2 to 3 minute videos that are designed for every parent and things, and you should be getting those either via email or via your text. And these are just designed just to be educational. Again, they're not judgmental. They're not judging you as a parent by any means. That is not our intent, because we certainly know that in this day and time, being a parent, being a guardian, being an aunt, uncle, or grandparent to a child is not an easy thing, especially given the last 2 years and things. So let me stop right there with my comments. Any thoughts, any concerns, any questions? Especially from the rock stars here. You don't have any questions? You got them all? All right. Well, I'm glad to hear you're good. That's important. Anyone else? You know, we certainly know that the topic at hand is one that's serious and is something that I do take very serious and things. So we do have to figure out a way how to normalize these conversations and be open about them, right? For the variety of different reasons why it is hard to talk about them. It's hard for children to talk to their parents about them. That's what some of the videos do, is encouraging how maybe to talk a little bit differently to your kids to get out of them whatever they're kind of going through, because they are going through a lot. There's a lot of pressure in this day and time. Coach Scriven, anything else from your vantage point? Yeah, so you should have gotten a wallet card. Ideally, it's your parents that need to reach out. And the wallet cards we have out front, it's a toll-free phone number. There's also a sheet of paper that summarizes what the services include. And if there's a concern in talking to your parents, then somehow find a way, an adult that you trust that can help you make that conversation with your parent to encourage them to call in, right? Because it is not our role to interfere with the parent's job or role, and this is a voluntary thing, and it requires your consent. And part of the video also talked about the training sessions that we will do just on a variety of different topics, and these are just designed to help you and to be educational. Coach, anything else? Sure.
Any questions? I want to thank all of you. Blacksburg, we're streaming this, so they're watching this as well. Blacksburg parents, Blacksburg High School parents and athletes, we appreciate you tuning in, and we're thankful. We are one. We are Cherokee County, so we appreciate you guys chiming in and watching this as well. If there are no questions right now, we have no questions, so Dr. Mayer, good. We appreciate you again. Y'all be blessed, be safe, and thank you again.